I would like to hand over to Raka, Associate Professor of Medical Microbiology and Infection Control at the University of Pristina, Kosovo. Like Ariana, he is the corresponding author of the contribution to our supplement journal. And I would really like to welcome Lul to take over and present the situation in Kosovo.
Hello, thank you very much for introduction and for organizing this conference to Bernard and Franz, and hello to all participants who are attending us. Let me trying to share my slides. Do you see them? And do you hear me, Bernard?
Yes, I can see you, and I can hear you, and I can see the slides. Fantastic.
I'll try to be short, not to take too much time. So, antimicrobial stewardship in Kosovo. I will start with main challenges in general in healthcare in Kosovo, and in particular in antimicrobial resistance field. First of all, the main challenge in my country is the budget, because Kosovo for decades, for 20 years, has been a country in Europe with lowest governmental per capita expenditures in healthcare, which is creating a huge problem. The other problem is we don't have yet health insurance system, which is, I think, from professional and medical point of view, unacceptable. And the third problem, which I would like to mention, is brain drain, because my best students for years now, maybe last 10 years, they are usually learn German, and they already are a huge number in Germany, in Switzerland, Austria, and elsewhere in Europe. In the field of antimicrobial resistance, one of the main challenges are self-medication of our patients or over-the-counter sale, which is still a problem, despite the fact that there is legal infrastructure that is banning that, but it is not implemented. The other problem and challenge is lack of clinical protocols and guidelines, and also huge pressure from pharmaceutical industry. In this slide and in other slides, you will see these cartoons that were part of awareness campaign in 2017, where with one of our best cartoonists in Kosovo, and after 1 year, all his 14 cartoons have been taken by World Health Organization and shared worldwide. I think you will like them also. First step to start in the field of antibiotic use in Kosovo was to have a clear picture where we are, and we started to collect data in wholesale data in 2011 with a project organized by WHO and the University of Antwerp. And since 2011, we collected data consecutively, and at that time we were 10th in Europe in DDD or we had, better say, DID of 26.3. This is a result. 5 years later, 6 years later, we had a decrease, significant decrease, 20.1 DID, and this was because of increasing awareness, process of increasing awareness in the population and among healthcare workers about antimicrobial resistance. That was media pressure and definitely governmental commitment to address antimicrobial resistance through healthcare professionals. But one problem, and it's still a challenge, was parental antibiotic use. This lady in picture is our gold medalist, Olympic medalist. Unfortunately, we were European champions with parental use of ceftriaxone for years. And when we checked the database, we saw that from some of companies, there was a monopoly of one company that still has a kind of monopoly, and they not force doctors to prescribe particular antibiotic, ceftriaxone, even in primary care. Where are we at the national level? Kosovo in 2019 started second national action plan. First one we had in 2011-2015, and the activities that were anticipated were completed 80%. Although we didn't have any financial support, but we search and succeed to get funds to apply for research grants, and every every cent were invested in national strategy and action plan. So actually we have this one with key action areas, as you see here. Part of these activities have been supported by Italian Agency of International Development and WHO. And this is an intersectorial decision for establishment of intersectorial group. And you can see here among 11 members, we have representatives from Ministry of Environment, from Kosovo Agency of Food and Veterinary, from Faculty of Agriculture, and all healthcare facilities in all levels. What is cornerstone or main activity in this current National Action Plan? It's a prudent antibiotic use and antibiotic stewardship program. And in this field, a team of our experts, we had consultation and we worked together with support with experts from Nancy Hospital in France, with Professor Céline, and we already prepared terms of reference for antimicrobial stewardship program with particular tasks for each stakeholder and each participant in this plan. But however, due to COVID-19 pandemic, the implementation of this program by health institution has been postponed for second part of this year, 2021. Actually, Ministry of Health has established a working group. I'm chairing that working group to prepare clinical guidelines for antibiotic use in primary care. It is an ongoing process. We just had some contacts with WHO, and we are looking forward also. This will be an opportunity to have experiences from Croatia with Ariana. So I will call her after the meeting. Another, I think, achievement is that 2 years ago, during the revision of essential medicine list in Ministry of Health, we used opportunity to introduce aware access watch reserve approach by WHO, because the revision of essential list was done in collaboration with WHO. So in September 2019, we adopted this approach, and so far 69% of antibiotics in use in Kosovo belong to access group, first group, and we are looking forward to improve this. Another important step in awareness and education. Last year, we launched, through support from Italian Agency of International Development, e-book in Albanian language. It was very well accepted by pupils, by teachers, and also by other countries where Albanian language is spoken, like in Albania and other minorities in neighboring countries in Macedonia, Serbia, or Montenegro. Surveillance of antibiotic resistance. Kosovo is collecting data within the CESAR group since 2014, and capacities of laboratory, public health laboratory in Kosovo has been increased every year. So in 2016 we have an index of only 3.6. It increased in 4.0 in 2017 and 4.3 in 2018. And we are looking forward to increase even higher this index, because last month we purchased within the AMR program sequencer, next generation sequencing, Illumina MySec, and already 2 months ago also Malditov and multiplex PCR. And this is first time that government is investing in AMR program and infection control. In the field of infection control, Ministry decided to prepare standalone national action plan, which I think is good. I was chairing both groups and trying to balance, because in many countries in Europe there is some fight between infection control and AMR for funds or for work. And patient safety within EU regulation and multimodal strategies will be one of the key aspects here. We also were including some research activities in the environment, looking for resistant genes in urban sewage, and also we are part of Eureka protocol and several research projects. Thank you very much. This is my short presentation. As Ariana mentioned, we also had challenges with antibiotic misuse during the pandemic, but and we are seeing huge misuse of carbapenems, and we are seeing also colistin resistance very often in ICU patients. Thank you very much.
Thank you very much, Lul, again for a very open and honest presentation. I'm sorry to hear that one of your problems is the brain drain, because this is really tough if you're good people, they go abroad. And secondly, I like your approach of using the cartoons to create the public awareness of this problem. And other than this, we keep our fingers crossed on your way towards implementing these systems. Thanks a lot. I got 2 comments from Finland, and I would like to read them briefly, these comments. And one comment is, it is good to evaluate the usage of antibiotics, for example, for the elderly people. Also other things like reducing the amount of wide-spectrum antibiotics. And then she says, or he says, it is also a challenge when in some countries antibiotics can be bought from the pharmacy without a doctor's prescription. And that's something you mentioned also for Kosovo, which reflects a big problem.
Yes.
Thank you very much, and all the best to Pristina.
Thank you.
Thank you. Bye.